Hey, Eastham. Welcome back to Turn It Up Eastham, the town's official podcast. I'm Kayla Urquhart, Communications Coordinator for the town, and I'm so glad you're joining us for episode 3. In this episode, we're highlighting 2 of my favorite local initiatives. First, we'll talk about the Community Fridge, a partnership between the town and local nonprofits that's helping residents access fresh food while reducing waste. Then we'll dive into CredibleMind, an online platform connecting Eastham residents to trusted mental health information and local resources. I'm excited to be joined by our Health Director, Hillary Greenberg-Lemos, who's here to share more about these meaningful programs and impact they're having in our community. So let's get started. Welcome, Hillary. Why don't you tell me a little bit about yourself and your role in Eastham?
So I'm Hillary. I'm the Director of Health and Environment. I oversee the Health Department and the Conservation Department. We're a staff of 1, 2, 3, 4, 5, including myself. And we do a number of different things in the community. But today, I think we wanted to focus on a couple of public health initiatives that we recently rolled out.
Yeah, so we're going to start with Community Fridge. It's one of my favorite public health initiatives that you have. I think it's a great community resource. So why don't you start with just telling me a little bit about what it all is and kind of how the idea came about.
Sure. So before I came to Eastham, I was working in Wellfleet. I had been there for a number of years, and the Community Fridge was something that I tried to get off the ground there. And when I came to Eastham, I had hopes of actually bringing it out here. So what it stemmed from was our public health needs assessment that we conducted, I think it was in 2023, showed that there was food insecurity in the town of Eastham. And so what a community fridge is, it's an anonymous place for people to come and get a snack, get a meal, get a lunch, get a dinner. It really depends on what is stocked in the fridge on a particular day, but there's no stigma attached. It's open to anyone in the community that is in need of anything.
So that all sounds really great. Can you tell me about how we have like so many donors that donate all of these items and kind of how the funding works for it?
Sure. So it is all donation or grant based. So the town has not put a single dollar into buying the equipment or stocking the fridge with food to date. We have received a number of grants to fund the purchase of the refrigerator. We also have a freezer, which was part of the plan so that the food that we put in the refrigerator could be moved over to the freezer so that nothing went to waste. We also work closely with Food for Kids in the summertime. They provide us with 10 meals minimum each day, Monday to Friday. That goes to families in Eastham. We have the Family Table Collaborative that we have paid for through a grant from Eversource, which has been really great. We currently get 15 meals a week from the Family Table Collaborative. And then we work closely with the Cape Cod Cooperative Extension, who has a food rescue program. And our most recent partnership with them through Andrea Scarpolini, their director, has been with Cumberland Farms. So every Thursday, we receive a delivery from Cumberland Farms to the office. Sometimes it's milk, sometimes it's snacks, sometimes it's bread, and it has really been doing a great job keeping our fridge full.
That's awesome. And how would you say that it's been received by residents so far?
So I think it's really great. It's actually one of my favorite times of the day is on Thursday around lunchtime when people start strolling in to grab a meal and they see what's there. It's allowed us to meet members of the community that we probably wouldn't meet, that probably wouldn't come into the health department. And it gives us an opportunity to talk to them while they're in about other public health programming that's going on. So it's really multifaceted. And, you know, what else we found from our survey was that people are lonely and depressed. And so it's a good opportunity for the staff to interact with residents who wouldn't normally come in, learn some public health facts along the way, and just check in.
Wow, I didn't really think about it that way, but that's awesome. For our listeners that may not know, how do they access the fridge and what hours is it available?
So it's available Monday to Friday. If the office is open, come on in or knock on the door. They can go in the front or the back, and we're actually located in the small building in between town hall and the fire station. So there's parking out front and there's parking out back, and if we're there, come on in.
Okay, so Is there anything else you want to add about the fridge? It sounds like
it's really fun. And if you're in the building, come in and introduce yourself, because not many people come in just to say hello. So it's been fun.
Cool. It's always nice to have a fun program that you get to meet our residents. Like, as you said, we don't typically get to have those casual conversations. So I would say this program's like really inspiring to see how town staff and the public has come together to make it possible. But I think you'll agree that wellness is a lot more than food and food security, and that, our mental well-being is also something that the town has taken on as initiatives.
So that was another item that was identified in our public health needs assessment. The two kind of ran parallel as some of the top priorities for us to work on that were easiest to do something that could make a difference. And so when we looked at that, we definitely know that coming out of COVID, people's mental health and wellness were suffering. People were lonely, they were isolated, and there was a lot of depression. So at that time, the Outer Cape health agents banded together and were trying to think of things that we could do to help out before folks got into crisis mode. And one of the things that came up, we had a health agents meeting held out of Barnstable, where I think it was Mashpee that brought this program to us. It's called CredibleMinds, and it's an online mental health and well-being platform. It was costly, and at the time it seemed a little bit out of reach, but it was something that we had always thought about.
Okay, so that's the second topic we're going to cover today is CredibleMinds. I've looked at the platform. It seems great. It has a lot of resources. Can you tell us, you mentioned the price of it. So how is the Outer Cape towns funding this program? So
it's interesting. I had applied for a grant from NACHA, which is a national organization for city and county health officials, and they were the first ones that chipped in to procure this. And it's based on population, and so we knew that we couldn't go it alone. So, of course, it made most sense to do Eastham, Wellfleet, Truro, and Provincetown. And at the same time, when we were costing it out, and we know that these problems are not just localized to the Outer Cape, I thought, I wonder if it would be possible to involve Orleans, Chatham, Brewster, Harwich in with us as well, because we have more power if we're 8 towns versus 4 towns. So our next step was to put together a grant to Cape Cod Healthcare for all 8 towns to receive funding. So it's based on population, and when we combined all those towns, it was within reach. And so we went for that, understanding that it was a lot, but we thought, to serve Cape Cod best, the more towns that have access to this platform, the better. Cape Cod Healthcare came through with some funding. And then the town of Harwich, through their opioid programming money, kicked in another sum. And the other thing we thought that would be important to fund would be some language translations. So Barnstable County, through a public health excellence grant, pitched in the rest of the money. So we have 3 translations available also. And all of that money cobbled together allowed us to procure the platform and the translations and have it available for residents of all 8 towns on the Cape.
That's really quite amazing. And we always want to help our neighbors and collaborate when we can. Do you want to tell our listeners about what the platform looks like, what resources are there, and what we could expect if we access it?
Sure, absolutely. So when you go, the website, I believe, is lowercape.credibleminds.com. If you go there, it's going to ask you where you come from. The first important thing to know is that it is all anonymous data. The reason we ask that is that so we can parse out information specific to our Outer Cape region versus the Lower Cape region. And you'll see when you're there, you can select another town in Barnstable County. But it's important to me that if you're on the Outer Cape, you check Outer Cape so that when we go to develop additional funding, we know sort of where our target audience is and what services we can look to providing. So in any case, you click on that and that brings you into the platform. There's all different topics from depression to anxiety to I feel like I'm a bad mom to nutrition nutrition to learning how to breathe to work burnout. So there's really a whole host of topics that you can explore. There's podcasts, there's exercise, there's breathing, there's meditations, there's vetted scientific articles, there's quizzes and self-assessments, which can be kind of fun depending on what kind of mood you're in. I mean, it's really a tool for everyone. And it also connects you to local resources. So that's sort of what makes this platform special, is that we also have our local resources in there. So, we went through all 8 towns and selected nonprofit organizations, medical providers, and the information is readily accessible. We have a special section for fishing families. It's really, really a neat tool, and I would encourage everyone in any state of mind to go on and check it out.
Yeah. So what would you say to someone that has never explored a resource like this?
It's fascinating. So I was one of the first folks to demo it, and I took a couple of the quizzes, and I learned some things about myself that I didn't necessarily know. So I would suggest, go on with an open mind. None of it's not going to hurt anyone in any way. It's going to give you useful tools, point you to articles, and the more information we all have, the better we're all doing.
Yeah. And I know you touched on, the gap between someone being in crisis and someone just needing a little bit of help. Can you kind of touch on that, on, how the local resources are going to play a part in this? And
Sure. So in addition to this program, we do have resources available in almost all of these towns to actually provide mental health services, nursing services, navigator services. And those are accessible. But this is sort of a stopgap measure before you would get to any of that. So if you're just feeling a little bit sad and you think you need some help, a lot of times there's an article that can help, or an exercise that you can do, or a breathing technique that can sort of get you to a place where you're feeling a little bit better. So it's really meant to be a first stop along the pathway. We know that it's difficult to get in with providers out here, and we just wanted a tool that would be available to people at all hours of the day, whenever they need it. Once you get into the tool, you can see if you are in immediate crisis, you will find the resources to get you the help that you need while you're there. So it's an interesting tool. We're curious to see if it works, if people actually utilize it. And we're real hopeful that it's going to help some folks. And it's really meant for everyone and anyone.
Cool. So you talked about this public health survey, and how would you say that this platform kind of fits into the bigger picture of Eastham and our health programs?
So what we found was that it's difficult to access providers. I think that's no mystery to anyone living out here. It can take months to get in with someone. And sometimes you may think your problem is a lot bigger than it is. And this is a way to just help yourself in the meantime. Find little bits of information that are going to help you get through the day.
Yeah. Totally. And I think these 2 programs definitely support those initiatives and the overall arching goal of public health in the community.
Yes, and they're manageable, right? A lot of times there's a lot of things we want to do, but we can't. We don't have control of it. We don't have enough resources or staffing to carry out massive programs. So these are 2 small initiatives that we hope make a difference in people's lives and at least bring them in the door to talk to us.
Wow. Yeah. That's great, Hillary. And thank you for you and your staff for, running both of these programs. I think our residents are happy we have such a supportive health department.
The other thing we're doing, which we might want to put out there, is the social media. On Mondays, we have Mind Matters, just a little bit of information to remind you that this program is there and it's easy to access. And it'll be just a little bite of information about a number of different topics that are relevant to mental health and wellness. So if you forget where to go, you can check the Mind Matters on Mondays, and it'll connect you in.
Yeah, and I think that's actually something we haven't touched on yet. So for our listeners or viewers, how can people access Credible Minds? I would say probably through our website.
I think through our website is probably the best. Or you could definitely go direct, and that's lowercape.crediblemind.
Mind, yeah.
Another way would be to go through the social media, the Facebook page, through one of the Monday Mind Matters. I believe it's on the health department website as well. If it's not, we'll get it on there. And then there is a Google feature. So if you happen to forget all of those other access points, if you go to Google and you type into your search bar depression or anxiety, it will take you there.
Perfect. Well, thank you so much, Hillary. I think our viewers are really going to enjoy all of these comments.
Great. I'm looking forward to coming back and talking about regulation changes that are upcoming, maybe some wastewater, maybe rental certificate programs.
Yes, we have so much to talk about in the world of public health. Thanks so much, Hillary. Both the Community Fridge and Credible Minds really show how Eastham comes together to support residents, from making sure everyone has access to fresh food to providing trusted mental health resources. It's these kind of programs that makes our town such a caring and connected place. And speaking of connecting with our community, let's take a look at some events happening around town. The Eastham Health Department will be holding a COVID and flu vaccination clinic on Monday, November 3rd at the Elks Lodge. More information on how to register can be found on our website under the Health Department page. And then the 19th annual duck race is on Saturday, November 22nd at 2 p.m. at First Encounter Beach. Grab your numbered yellow duck and watch them race down Bees River and maybe win a Thanksgiving turkey or a pie. Registration starts on November 10th. Call the rec department for more information. That's going to be a wrap on today's episode of Turn It Up Eastham. We hope this conversation helps shed some light on these two very important public health programs. Thank you to all of you for listening, and I hope you enjoyed this episode. Be sure to subscribe so you never miss an update. You can find more information on our website and follow us on social media for the latest news and announcements. We'll be back soon with another episode where we'll keep bringing you stories, updates, and insights from around Eastham. Until then, take care, and thanks for tuning in to Turn It Up Eastham.